ASU's Edson College of Nursing and Health Innovation recently received a major grant to create an Edward R. Royable Center. It will study the issue of aging solo and living alone while in cognitive decline. Tonight, as part of our monthly AARP-sponsored segment highlighting issues important to older Arizonans, we'll learn more about the center. Joining us is Edson College of Nursing and Health Innovation Professor Fong Yu. Thank you so much for coming in. Hey, before we start talking about the center, will you explain or describe cognitive decline? Because I think it means different things to different people.
That's a very good question. It's indeed true. When we talk about cognitive decline, it can be in multiple phases. So initially, when people begin to notice themselves, their cognition is declining. That's called subjective cognitive decline. And then as the cognitive decline progresses, when they do some cognitive testing, there are going to be objective evidence that they do score lower compared to their age, education, sex-adjusted peers. That if they enter that phase, is called mild cognitive impairment. So or MCI, at this phase, they both have subjective and objective cognitive decline. And then as the cognition declines further, it affects their daily functioning. Their function declines from a previous higher level to a lower level. That's more than likely they're entering into the dementia phase.
So what would be something I would notice myself? Is it forgetfulness or?
Yeah, so forgetfulness is typically what happens during midlife. Like I experience that myself. Sometimes I forget things, but the normal aging process for forgetfulness is you can recall what you forget, maybe minutes later or hours later. But for people who really have Alzheimer's disease-related cognitive decline, they may not be able to recall them down the road, even with cues.
Thank you for that. What kind of work will take place at the center?
So our center, we're super excited about having this center because we really hope to engage older adults living alone with cognitive decline to understand their needs and hopefully develop interventions or programs that can help them continue to live alone. Because we know most of those people who live alone prefer to continue to live alone, and increasing their functional level, emotional well-being will likely improve their quality of life and hopefully delay nursing home placement.
So a couple of areas that I think the center will address, and certainly correct me if I'm wrong, technology-enabled lifestyles and behavioral intervention. Can you talk about what that means?
Definitely. Technology, because for people living alone, even in the general population, we know there are not enough providers to care for every person who has cognitive decline. That's why a lot of family members are serving the role as informal caregivers. So what our center is hoping to bridge the gap in the lack of caregivers is using technology to augment existing care and services. For example, the technology we are looking at including web-based care programs or app-based programs or some virtual reality or AI-driven algorithms that can help people make better decisions to improve their function and to improve their daily life. So that's the technology piece. The behavior and lifestyle piece is based on the fact 30 to 40% of cognitive decline was due to behavior like exercise, how well you manage chronic conditions, how you sleep, what you eat. Those factors.
30 to 40%
yes,
is a result of not taking care of ourselves?
Mm-hmm.
Wow. Okay, so sorry, I cut you off. That just blew my mind. That's makes me want to get up and start walking right now.
Exactly.
So how then do you intervene? Is that educating people about the importance of the exercise and the eating healthy foods and sleeping well?
Yes, that's one important component of behavior change, educating people, empowering people, provide them with tools and knowledge how they can change it themselves, and also developing programs that they can go to if they don't want to do it on their own. And besides going to a program, may have social interaction benefits too, so that reduce social isolation for people living alone. And many of those connections can be made via technology, like Facebook type of technology can connect people. So that's what we're hoping to do in the center.
We have just about 30 seconds or so left here. Can you tell me who you're looking to help? Because this is based here at ASU, but this isn't just limited to the Valley.
Right, you're right. We are open to fund studies across the nation, so anyone could apply if they meet the criteria of technology-enabled intervention to change behavior to improve lifestyles for older adults living alone with cognitive decline.
Professor Bong Yu, thank you so much for coming in and encouraging me to
having me.
exercise more, even though you probably didn't intend to when you came in. Thank you so much.
Thanks.